Hello, everyone. A very good evening and welcome to the Let's Talk series, episode 3, organized by Aesthetic Medicine India and powered by Galderma. One of our most recent introductions, the Let's Talk series, was launched last year with our first episode on personalized with Restylane Define with Dr. Narmada Matang and Dr. Divita Buraria. This was then followed by a second episode on lip fillers with Dr. Apratim Goyal and Dr. Akanksha Singh Cornot. And today's webinar, which is our third episode, will focus on achieving radiant skin with original skin boosters. I am Shriyal Sethumadhavan, the Executive Editor of Aesthetic Medicine India, and on behalf of the Aesthetic Medicine team, I would like to thank our partner Galderma, our guests and speakers, and our viewers for joining us today. So what is the Let's Talk series all about? Organized by Aesthetic Medicine and powered by Galderma, every episode of the Let's Talk series brings together two aesthetic medicine practitioners to discuss an aesthetic treatment along with some impactful, challenging case studies. Aesthetic Medicine, founded in the UK 18 years ago, is the original business-to-business magazine in India for discerning aesthetic professionals. I would say the magazine is a must-read for medical practitioners such as dermatologists, clinic managers, plastic surgeons, selected aestheticians, and cosmetologists. The Aesthetic Medicine Expo and Conference was introduced in India in 2019 with the aim to connect the medical fraternity with the supply chain stakeholders and provide a platform for networking, sourcing, and training. Then came 2020, and since the world was besieged with the pandemic, we at Aesthetic Medicine took on the challenge and set ourselves on an exciting digital journey. In all success, the Aesthetic Medicine Digital series were introduced, and our webinars and online interactions with experts have been instrumental in bringing vital information to practitioners on various treatment and discussions revolving around practice management. I am also delighted to announce, and this is the first time I'm announcing it on our virtual event, that we are gearing up to bring back our physical event once again in Mumbai. Rebooting the India aesthetic medicine industry, the Aesthetic Medicine India show, which is going to be a blend of an exhibition and panel discussion among India's leading dermatologists, will take place on May 29th this year at the St. Regis Hotel in Mumbai. More details are available on our website, which is aestheticmed.in. I will key that in for you in the chat box soon so that you can access it. Apart from that, of course, we are very active on our webinar platform. We have a YouTube channel. We are there right on social media, Instagram and Facebook for the aesthetic medicine community. All you need to do is search Aesthetic Medicine India and you will find us right there. So today's webinar will focus on achieving radiant skin with the original skin boosters. But before I detail the topic and introduce you to our eminent speakers, our doctors that we have with us today, let me present to you a video from our partner, Galderma. This video is a patient education video, so you can contact your local Galderma representative to install the video in your clinics as well. So coming to today's session, in today's Let's Talk series, episode 3, we have Dr. Manu Agarwal, Medical Director, SALT Salt Skin, Hair and Laser Clinic, Delhi, and Dr. Naveen Atluru, Co-founder and Senior Consultant, Nawa Skin and Body, Hyderabad, talk about the original skin boosters. Before I request the doctors to take over, I would like to introduce them with a few more words. Dr. Manu Agarwal is a foremost expert in aesthetic medicine. With several years of experience in beautifying individuals of various backgrounds, he has been a national and international trainer in anti-aging and fillers and has the credit of training over 800 dermatologists and plastic surgeons in the art of facial rejuvenation with injectable. A medical graduate by the virtue of his education, Dr. Agarwal is most renowned for his sharp eye for facial aesthetics, par excellence injector skills, and is at the forefront of non-surgical cosmetic medicine. Thank you, Dr. Agarwal, for joining us today. Request you to put your camera on, please. Next, Dr. Naveen Atluru. He's a popular dermatologist in Hyderabad and has been a practicing dermatologist for over 11 years. He believes in working hand in hand with his patients to get their skin looking healthy, gorgeous, natural, and new. He completed his MBBS from Dr. NTR University of Health Sciences, Andhra Pradesh, and MD from Sri Ramchandra University, Chennai. Thank you, Dr. Naveen, for joining us as well. Request you to put your video on. I now request Dr. Manu to take this discussion forward with Dr. Naveen on today's topic of achieving radiant skin with original skin boosters. We have 45 minutes for the discussion, and it would be followed with a Q&A with our attendees. So yes, all my viewers, if you have questions, please do put it in the Q&A box. At the bottom of your screen, you would see a Q&A box and a chat box. My request to you is to key in your questions only and only into the Q&A box. The chat box is for any communication that I would want to have with you or you would want to have with me. But otherwise, for the doctors, go straight to the Q&A box. We look forward to an engaging discussion. And with that, over to you, Dr. Manu.
Yeah, thank you, Shreya. Thank you for introducing me. So good evening, guys. So Shreya, could you just get the presentation on? Thank you.
Sure, just doing that.
Yeah, so I think Shreya has already introduced me, a brief about me, and it looks literally very pleasant.
Just give me a second. I'll just share that again.
It's a very pleasant feeling to hear good words about yourself. Thank you, Shreya. So in the meantime, till the Shreya sets the PPT on. So just in this session, we'll be taking you through skin boosters, which are the original skin boosters from Restylane brand. Yeah, thank you. So the basic theme of this session would be achieving a radiant skin through Restylane skin boosters. Next slide, please. So this slide talks about the entire Galadama aesthetic collection. So it's not only the skin boosters. We have in the aesthetic collections of Galadama, we have toxin, Dysport, which is usually used for relaxing the muscles, for fine lines, etc. Then we have dermal fillers, which can do lifting. The advantage with the Galadama collection is you have specific fillers for like kiss for lips. For specific indication, you can use the specific fillers. And last but not the least, this real skin boosters. That would be the topic of discussion for today. Next slide, please. Thank you. So if you just go into the science of Restylane fillers, there are basically two technologies they are using. The NASA technology, which is the basis for skin boosters or the lift fillers. And the other one is the OBT technology. They are for those fillers for which we required any contouring or expressions. For example, they are Kais variety, Defen variety, or the volume variety. We'll just go through it in a bit in the next slides. The next slide, please. See, when we talk about the NASA technology, it's the patented technology of the Restylane. The full form is non-animal stabilized hyaluronic acid. So just going into the science and the specialty or the patent of the NASA is there is a very less degree of cross-linking in the hyaluronic acid which is used in this technology. There are different types of particle sizes and there are different types of gel textures. Depending on that, the different types of fillers have been designed, like skin boosters among one of them. So depending on the different particle sizing and the texture, there are different varieties of the fillers which has been designed by the Restylane. Next slide, please. Yeah, this is the USP of this product. This product comes with a smart click activation. So usually, if you are an initial injector, this technology is a blessing for you. With this technology, you can control the amount of filler that is injected at the per click. That makes it easier for the injector to focus on the process rather than focusing on the syringe, how much syringe is left. So for the beginners, it's obviously a boom. They can focus on the area which they are injecting with the automatic smart click technology. And for the experience holders also, this is very useful because this gives you an idea how much is being injected at every click. So to get the user-friendly experience of this, you should try this product with this technology. Next one, please. Yeah, that's the general slide. With all the skin boosters, what we are aiming at. We are aiming at a long-term results. It gives you an hydration. On and above what current hydration you have, it adds on to that. Not only hydration, it enhances your glow, it gives you a radiant skin, it improves the elasticity, smoothness of the skin, overall improves the skin structure. So if somebody in your clinic walks in looking for a plumpy, good, hydrated, healthy skin, then skin boosters is the answer. Next slide, please. So as per the approved indications for skin boosters, it can be used around the perioral areas, decolletage, a cordon areas, there's the lower cheeks areas, and the crow's feet, fine lines as well. And one more interesting factor, it can be used for the hands. In my experience, skin boosters are one of the most promising thing that can be used for aging hands as well as for young hands that need hydration. Next slide, please. Okay, having said that, now let's see what skin boosters can do and how we can adopt that skin boosters in our practice. So I am going to share some of my personal cases. I would like Dr. Naveen to share his views as well. So she is a 26-year client, walks at my clinic for some skin glow. She is a bride, go to be bride, planning to get married in a couple of months. So I started her on a basic skin polishing with the MDA, but she was not happy. She was looking something else, something much more brighter things, some better glow on the face. Then probably I advised her for Vital. Looking at the cost, she didn't agree in the beginning, but after a month she came back and we did Vital for her. Dr. Naveen, I would just like you to if this such cases you must be seeing in your practice, those pre-bridal bookings. So how do you manage these cases? Do you follow the same line of action or you're doing something different? Just your thoughts on that.
Dr.
Dr. Naveen?
Naveen, you are on mute. If you could please unmute yourself.
Sorry. Thank you. Hi, good evening. So yes, sorry about that. So one of the sad things about this is that always these brides come at the last minute, and they want the last minute change that can do the best, give them the best effect. So for my take on this is that, this is an excellent treatment with minimal downtime, not much pain as we apply topical anesthetic as well. And it gives a radiance and glow that, if you have at least a month's time, you can have those effects kick in within 2 to 3 weeks and will last for almost like 7 months, and this type of effect for a bride who has some events and then along with some photo shoots that may be going around and, then she may travel with her newlywed spouse. These type of changes she'd want to extend as much as possible with minimal downtime. And this is an excellent treatment modality in which these type of patients and clients can achieve these results and look like nothing was ever done. And that's the whole point of it.
Yeah, thanks, Dr. Naveen. Thanks for sharing that. Just one more point on this, Dr. Naveen. Usually when such patients come to a clinic, they have a lot of demands, being a pre-bridal stuff. So they are not only satisfied with the glow. So apart from the Vital, do you want to combine anything else in the treatment? Usually for the to enhance the glow.
I mean, if usually I have these patients before they even do any of these treatments would be like on some sort of oral antioxidants, maybe even oral glutathione to, at least boost whatever is internally with them. But in the practice on table, when someone comes and says, I want more to show, then there's only so much we can do as a practitioner. We know how much we can really pull from them. So maybe a photofacial, LED photofacial, maybe some sort of very, very light energy-based device to give a little lift or something, a clear lift, a fractionated Q-switch Nd:YAG laser, some sort of laser toning if she has the time. Like I said, if they're coming 1 month before, there's only so much we can do, but with this type of timeline, this would be like the quote unquote cherry on top of a treatment. If she was coming, say, for the past 7 months, this would be the icing on the cake. You get this done, you're out the door for 7 months. You don't have to worry about your skin at all. So this usually is the max that we can pull when we start using these skin boosters, from my experience.
Oh, excellent, Dr. Naveen. So usually how I handle these cases are if a timeline is within 15 days or if the timeline is more than 15 days. If it is more than 15 days, I usually put them on photofacials or some laser toning stuff, followed by skin boosters. But usually it doesn't happen. Most of the time, the timelines would be within 10 to 15 days. So in that case, I usually combine a botulinum toxin. I do a meso with the botulinum toxin along with the skin boosters with that. So along with the shine and the glow, they get bit of tightening as well. That makes them happy.
Correct.
So
and it gives a much more hydrated appearance. They look like they slept well. Someone would come up to them and like, hey, did you have a massage yesterday, or did you go get a facial or something? If done correctly, it will give very, very, very good results.
Yeah, exactly. So this is the approach of a pre-bridal, I guess. That's one of the best thing you can do for a bride.
Yeah, I agree.
You can get a glow
with no downtime.
with no downtime. That's an important thing. Okay. Just moving on to the next case. See, most of the time what happens is skin boosters, there's a case of a male that skin booster doesn't only apply or only give results in females, they're applicable for male as well. So in the current scenario, I am surprised with the practice over the past half a decade, the male aesthetic clients have increased a lot. There's a huge demand among the males for aesthetics. So my approach would be, yeah. So whenever a male client walks in, they are very fond of getting a glow and the immediate results. Plus, male client wants something. They don't want to visit the clinic on monthly basis or once or twice. So for these cases, I usually prefer a Vital. That's the Restylane skin boosters that do amazing wonders for them. Just your opinion, Dr. Naveen.
In terms of male patients, yes, for sure. It's definitely increasing slowly. A lot more awareness is coming out, especially with, the types of content that's provided to everyone on a daily basis through social media or what have you. So male clients, when they come, a couple of things that they usually look into is like, I have these scars, I have this pigmentation, I want to do this, I want to do that. And they have these expectations, like you said previously. We have to manage these expectations. We have to take them one step at a time. What exactly caused these scars? Do you still have acne? Do you have, so go about the roots of treating what's, the root cause, and then getting to a point when they get that confidence within you, they trust you. Oh, this guy's really taking care of me. He really cares about me. And then they may be taking this step forward. Okay, let me, try an injectable. I've never heard about it before. Tell me about it. And then we explain to them, maybe show some before and after images, and let them see the product, let them hold it, let them understand what it's about. And then when you do a skin booster for a male, the types of effects that they get, they're blown away by it. They're like, oh wow, that it took so little time, no pain. And to be honest, I have found that women have a much higher threshold to pain than men. So they are able to tolerate it well as well. And obviously this is with topical anesthesia, but the types of smoothness and texture refinement that one would get is much more prominent in a male than in a then I guess you would say the color change and glow. But they'll be very impressed with the.
Yeah, I totally agree with you, Dr. Naveen. Male clients are easy to convince, and with the glow they get immediately after the boosters, they become your lifetime patients. So that's
Yeah.
a boom for them. Yeah, thank you for sharing that. Okay, over to the next case. So she is a 35-year female, comes with a complaint of a under eye circle and under eye hollowness. So the usual approach which any dermatologist will follow is they will put a dermal filler under the eye to get the hollowness done. I did the same thing. So, but she was not happy with that. She still complained, okay, the hollowness is better, the wrinklings are better, but the skin quality is still poor. So she was not happy. So just move on to the next slide. So I decided to put a skin booster under the eye. So just a disclaimer, it's an off-label indication putting the skin booster under the eye area. The major effect would be it can lead to Tyndall effect. So you have to be very careful, or you need to be an experienced injector before doing that. The idea of showing this case is the skin boosters are not only for skin glow. They can be helpful in treating or in as adjuvant treatment in the main concerns of the patient these days. That's under eye circles, dark circles, pigmentations, acne scars. We can work very well and as an adjuvant to these cases. So you can see the improvement with just 1 ml of the skin boosters. The skin quality keeps on enhancing, and this makes the patients happy. You must be experiencing similar cases, Dr. Naveen.
Yeah,
So
for
how do you
sure.
go?
I actually had a doctor. You know, she's a gynecologist, worked in a hospital, long hours, and skinny. You know, so definitely more of the hollow anatomy was there. And over time, because of the way her lifestyle led to darkness, hollow crept up. You know, skin type 4 or 5. So we put 1 ml under her under eyes, half a ml as an off-label indication as well. And I was doing it more for just giving a slight little lift and tightness, texture improvement. But the amount of pull on the pigmentation that came out, she was also astounded. She was like, wow, this really pulled a lot more than I expected it to. And she came 9 months later and did it again, and that was it. And that's the ideal client. You don't hear from them, they come back and they said it worked really well. And definitely it helped a lot with the color. I would also like to add that this is not only, this is not the number one indicated treatment for under eye color, the darkness, and it won't give that type of lift one would expect for a hollow, but this is something that would, smoothen out those fine line wrinkles, an aged male, maybe someone who is a chronic smoker, and you can see the fine line wrinkles come a little bit more. This is the type of product for the under eyes, which I feel is, would be like one of the best type of uses.
Yeah, obviously, Dr. Navi, thanks for sharing that. So yeah, just moving on to the next slide for this patient, you can see the results, and
Yeah.
this is something she was very happy with that. So now she comes regularly and get the skin boosters done. Now I'm doing skin boosters every 6 months. So that makes her really happy these days. Over to the next case, please. So this is the thing I was just I deliberately want to bring this case about to bring out the focus of skin boosters in the pigment patients. So this patient of mine was an anti-pigmentation therapy. I was not using any hydroquinone related stuffs. I did few PRPs, facial PRPs for her, but the amount of improvement we get with that, she was not happy because I can see the pigmentation is going down, but the hydration was so poor. This because of the lack of shine, you can't see the difference. Then I decided to inject skin boosters with her, and to my surprise, the results were awesome. Because of the hydration, the decrease, the whatever pigmentation was decreased, it was highlighted to such an extent. Now she comes regularly every year for the skin booster thing. Just your views on this, Dr. Naveen. Any cases, any experience of this sort with you?
I actually had a very similar case to this as well, in which I had a woman with very, very bad facial melasma all over the face. And to be honest, I just finished my third PRP bar GFC session to the face. And I am seeing some improvement. And this was going to be the added treatment I was going to give on top. So now seeing your results is making me actually, be more anxious to start to see what I can pull from her as well.
Excellent, doc. Excellent. You must do it. It really gives very nice results. Okay. Over to the next slide, please. Yeah. So this is something I think bread and butter of every dermatologist clinic, the acne and the acne scars. So she's a 27-year-old female, single. She has been coming to my clinic since almost 2 years for her acne. Her acne, you start the antibiotics, you start the acne treatment, the acne goes off, again comes back, on and off, on and off. This was happening with her for almost 1.5 years. So I started to put her on IPL laser, that pulse light laser. So it did show some improvement with the acne occurrence and the acne frequency. But still that dryness and the hydration was there. So the acne marks were very much highlighted. Then I asked her to, okay, why not put her on skin boosters? So we did skin boosters for her every 45 days for next 9 months. And to my surprise, the results were awesome. She got a perfect plumpiness, and all those acne scars just vanished. Obviously, I'm using some anti-acne treatments plus depigmenting creams. Again, no hydroquinone. There's a normal kojic acid depigmenting creams. But adding a skin boosters to this did wonders for her. Just your opinion on any of these cases. Have you been using acne scars? Because in my opinion, currently what we are using is acne scars. We usually go with the higher volume, thicker fillers. But that was my usual practice.
Usually a little bit more denser fillers to put under each scar to give a little bit more of a lift.
Yeah, exactly.
But something like this, if you can micro droplet across all the skin and give more of a, I guess you can say, a push from all sides and lift the skin, then definitely this would be a ideal type of treatment because it's just much more.
And the best part is, these skin boosters comes with a smart click technology. So this is where the technology use comes into action. With a small acne scar, you can just do minimal droplets. You can inject minimally and at all the desired levels. I usually in the acne scars,
for a newbie or something, this would be something that would be very ideal because it's very easy to use. They'll just understand. You don't know how much to push. The device tells you. It's done.
Exactly. And with this, especially with the smart click technology, I can just even on the small acne scars, I can focus the product. I usually put the product at 2 depths in these cases. So that is usually helpful. It saves a lot of product. Go to the next slide, please. Yeah, that's the case of Dr. Naveen. He is an expert in injecting on the hand.
I will just begin by saying that this is a client of mine. She's a 24, 25-year-old female, highly anxious, very OCD, loves to wash her hands, loves to sterilize her hands. I would say minimum 50 times a day, and to a point where they became so dry, tiny maceration cuts, everything, because of how much she would pick at the dry skin. She tried every moisturizer on the sun, ointments, even, just strict Vaseline, aloe vera, as thick as she can get, still no resolution of symptoms. So I said, you know what, let's try, this new product. It's called the Restylane Skin Booster. Why don't you try it out? So we put 1 ml in each hand. And for about the past, and this was done about, I would say about like now almost 8 to 9 months. I haven't heard back from her, which is a good thing. She recently messaged saying that I do need to come back for my follow-up. And I said, how have your hands been doing? And she said, it's better than it was ever in the summer. It's the worst in the winter, and that I don't even feel it then too. And I'm able to continue, even though I have this OCD, I'm able to limit the amount of times I'm washing my hand, but I don't feel that dryness anymore. I don't have the cuts. I'm not at all, inconvenienced by shaking someone's hand. That social stigma is no longer there. And she's taking care of it well. When someone sees that change with the amount of, time and investment, whether it's finances or, whatever, to get this procedure done, when they see the change start happening, then definitely, they'll invest more time at home to care for it, guard it, protect it, keep it as long as they can. So this was a great case that I love to show for using it on a young individual, not just for rejuvenation of an older individual, as you were saying in the beginning.
Okay, excellent, Doc. So, Doc, any experience of hand injections with the aged hands, somewhere around 50 years of age? How do you approach that case?
Oh, I'm so sorry. I'm having a technical glitch. I can't hear much. I just will have to leave the session for a second and rejoin back in if that's okay.
Yeah, no worries, doc.
Okay, 1 second.
So, in my experience, if I get a younger client, that's the best approach we can adopt. At the same time, usually in the clinical practice, we'll get a client aged about 40, 45, 50 or 50 plus with the anti-aging hands with a lot of wrinkles. So usually I don't use skin boosters as a standalone treatment because
Yeah.
skin boosters can just give an hydration.
Mhm.
So standalone, they usually don't work, what I've seen. So I usually put these patients either on an RF therapy
Mm.
or I'll use some heavy fillers, and top to that, I'll use the skin hydration, skin boosters for hydration.
And this is for older age individuals, you're saying?
For
Not
older,
the young.
for older patients.
Yeah, I've also been told that, and also heard that usually these RF sessions should be done prior to using skin boosters because you don't want to melt the filler after. But as it's a lighter filler, if you do have any lumps or bumps, sometimes with practitioner error, you can have it settle in a little bit more superficial than you want. 1 or 2 RF sessions post this will definitely, smoothen that out and give more hydrated appearance for the whole session.
Excellent, Doc. Doc, just one more query I have. How do you use these uh, syringes on the hand? You use the needles or use the cannula? I usually prefer using cannula on the hands.
So actually, to be honest, for her, we did use a needle, and you can even see the poke marks. We used a needle on her. To be honest, I've never tried it with cannula on the hands. Maybe it might be a simpler thing. Maybe when we do a filler for the rejuvenation, it might be a little bit easier. You know where to doppler this. It just made sense to draw a box and go with it. And she was anesthetized for almost 40 minutes, but that's a very unique technique. I would love to learn how to do it with the hand, with the cannula as well. That's something.
Okay, sounds good, Doc. Yeah, over to the next slide.
Thank you.
Yeah, thank you. That's fine. So, Doc, just want to understand, see, what I have been experiencing in my clinical practice when I started 14 years back, usually I had a mindset that the skin boosters are just for glow. Over the period of time with the experience, I realized it's not only for the glow. It can be used as an adjuvant treatment with more or less all the dermatological concerns.
Yes.
So just want to understand what's your experience about that.
So like we said, we are a medically licensed dermatologist, which means it's skin, hair, nail, and in skin, it's clinical as well as aesthetic. So like we just saw in the previous case, this was a patient who had like an OCD. This is not something that she wanted. This is more of a need for her. She needs to get this done so she doesn't suffer. So a clinical indication as such, where these type of aesthetic treatments can be used, is definitely plausible, definitely easily done, and you can see many cases of that. But in terms of the aesthetic indications, of course, this is definitely a cherry on top to the treatment. If you're a patient for 7 months with me and you've been doing laser toning, doing acne scar resurfacing, and what have you, and then your wedding is a month away, this is the type of treatment to do. Do you have any comments on that other than what I've mentioned?
Yeah, Dr. Naveen, I think I agree with you. But a couple of add-ons to this. See, usually I find very few patients who come to clinic with just a skin glow. The usual complaints, the patients come with come with some pigmentation or acne or something. Usually, okay, if she's a young girl, bridal or something, they can ask for a skin glow or lack of hydration. Because once they are in, usually what my tactics are, once I start the acne or the pigmentation treatment for them, and once they start getting the results, then I introduce them to the skin boosters, just to
Yeah.
make sure that once they are hydrated, then the results get enhanced several times. And in the same way, once the acne and the pigmentation has been started, they can see the improvement. So the trust between the patient and the doctor builds up.
Yes,
So
for sure. Like we mentioned, you do want to treat all the underlying causes. You can't just use this if there's active acne, if there's some sort of pigment. You have to treat the initial cause. And you also, at the end of the day, this patient has to protect what you've given them.
Dr. Naveen, sorry, but could you be a little louder? Our attendees are not able to hear you clearly.
Yeah, can you hear me now? Is that
Yes,
louder?
perfect, perfect, yes.
Yeah, so what I was saying is that, these are all treatments that you first want to evaluate the patient, assessing your patient, setting their expectations, treating the underlying cause of what's really causing their problems, then coming to this as a more of like toward the end of the treatment. There are definitely indications that, if someone says, I don't have time to do this, I don't want to take care of myself, I'm not that type of person, I won't be able to do, then these type of injectable treatments might be a better option for them and definitely will give them the results that they're looking for.
Okay. So I can see one Q&A section. You can see one question.
Yeah.
Any experience with the long-standing hand eczema? So, frankly speaking, I don't have any experience in the hand eczema. I haven't tried this skin boosters in the hand eczema cases. Do you have
So
anything
one
to say?
person wrote a question: can we use it in the forehead? Now, I'll be very honest with you. I've done it, and that too on an elderly male, 65 years old, skin type 6. He's pretty dark, to be honest, Indian male, very dark. And in certain places, especially towards the lateral aspects where the skin gets a little bit thinner, where there's not that much thickness because of the cold, some of the filler did get deposited a little bit more superficial. Now that did lead to a couple of lumps and bumps in certain aspects on his forehead. It took about almost 6 weeks for that to fully settle down. Usually that shouldn't happen if you place it elsewhere. Within 48 hours, these things have gone away. So to be honest, luckily he was a family relative. It wasn't so much of an issue in terms of that, but this was something that, it was a trial. We wanted to see how it was. Very, very dry skin, didn't hydrate well at all, didn't drink lots of water.
So just to add on here, see, forehead is an off-label indication. So I
Yes.
too use the skin boosters on the forehead. But two things I think which I always take care of. When I'm injecting the central part of the forehead, the chance of bruise is very high. And secondly, whenever I am injecting, I inject a very small amount, and I make sure after every injection, I just massage that area. Otherwise, it will definitely gonna leave the lump. And believe me, the lump doesn't go easily. It takes more than 10, 12 days to settle down.
Yeah,
And
I said 6 weeks.
Yeah. Another thing is about the neck rejuvenation. The outcome for the using skin boosters in neck rejuvenation is excellent. This is something which really works for the next fine lines, but again, it's an off-label indication.
Mhm.
At the same time, the chance of leaving a lump in the neck is very high. You leave all those beaded necks, which takes months to go. That actually makes the patient very uncomfortable.
Correct.
So I would request, if you're an initial injector, don't use it in neck. As and all you start experiencing the product, you know how much massaging is required, and with experience, then you can obviously go ahead with the neck ones. But in the beginning, please don't do that.
Yeah.
Because neck would be like small pellets that would be visible, and your patient will make your life hell. Don't do that, please.
Yeah, so there are some questions that keep coming in about like what are the costs, how much is used for the whole phase, how many sessions is one required. So in a brief summary, if you can say, you can assume that 1 ml per cheek. Maybe if you are doing an off-label indication like forehead or perioral area lips or something, you can combine that as 1 to 2 ml. But this is something that is very affordable. The pricing you can find out from your local Galadama representative based on the quantity that you are buying. And when it comes to I just saw one more question someone asked, and it had to do with, let's go back. Yeah, so like we said, if they had those bumps, what would it do to make them go away faster? Is there anything you can do to remedy the situation in terms of creating a sort of quote-unquote unwanted side effect or unwanted? So like we discussed before for the hand, Dr. Manu said that we can definitely use RF on top of it. It will melt the filler a little bit because of the heat that's generated. That would be something you can definitely give as a, come back in, let me see, let's take a look. This is something we wanted to add to the treatment. So you make the patient feel comfortable, and at the same time, you also don't make yourself look at fault that maybe something could have gone in wrong.
Yeah, just to add on to this, Dr. Naveen, see, usually we put the skin boosters in the deep dermal layers.
Yeah, that was another question. Where do we deposit?
So we have to make sure whenever we are injecting at any point, we need to stretch the skin and then put the needle inside. Once you are stretching the skin, you are sure the needle will go into the deep dermal layers. Secondly, it should be injected at an angle of 30 degree to the skin, and try to inject very small amount in the beginning. And as soon as you inject it, see how to feel the depth. Many a times you're injecting the skin booster superficially. If it is superficial, then definitely bump will come. Even if you massage it, the bump won't go.
Yeah.
So once you are in the skin at an angle of 30 degrees, make sure the needle is not visible. You just poke the needle towards the skin will come out, the skin will bump out. You won't be able to see the needle length. That's the correct pin to inject. If you can see the needle, then don't inject it. Come out, go further deep, and then do it.
Yeah.
And make sure you are stretching the skin at every point before injecting it. In these two ways, you will avoid the bump. In case the bump comes, then obviously massage is the best thing. What I do, usually use a thumb, go on the bump directly and rotate it, and then drag it laterally. This usually solves it, but keep an eye on the patient for next 24 hours. I haven't seen any case of skin boosters where I had to use an highlights to remove this.
Yeah,
automatically it's done.
It's not
So
needed.
I don't think bump is a problem as long as you're not doing on the forehead. With the forehead and the neck, you have to be very careful.
A lot of people are asking Doc about the combination with PRP for the face. So it looked like you had a very nice case, and you see that you had good results with it. I'm also anxious to try.
See, usually just try to understand PRP are the growth factors and skin boosters are the hyaluronic acid.
Yep.
So if you're injecting it together, not recommended, because growth factors will eat up the hyaluronic acid.
Yeah.
And the effect would be good, but it wanes away in 20 days. So what I usually practice it, I'll do a face PRP for first 3 sittings at a week of 2 to 3 weeks gap. My patients start getting the effect of face PRPs, the glow and the shine. Then I introduce the product skin boosters to them to get that elasticity and the plumpiness. So already the shine is there, then the plumpiness makes them excited. Second thing is, don't introduce everything to your patient on the first go, because the budget goes.
Just some people are
budget goes too high, and they don't come back.
Like you said, so initial PRP sessions, then go to the skin boosters.
So what I usually do is 3 PRP sessions at a gap of 2 to 3 weeks. Then I take a gap of 1 month, then introduce skin boosters, then nothing for next 6 months. So this is the user protocol I have.
Yeah.
If it's a highly pigmented case, then I usually do 5 PRPs before introducing a skin booster to that.
Okay.
So that really gives good results over the long term. And believe me, but make sure that the basic skin care is always there with the patient. So usually what happens is, whenever the patient walks to any aesthetic treatment, we do the treatment and the patient walks away. The focus should be that I always tell my patients, I'm just injecting. This procedure won't give the 100% outcome unless and until you work out. You need to work out the basic skincare. See, over the experience, I have learned there is no replacement of a basic skincare. Some vitamin C serums, some moisturizers, face wash, sunscreen, retinol. There's no niacinamide serums. You have to use those products. Unless and until you're missing any of these products, the results will be compromised for sure.
Yeah.
If the patient
all else fails, at least use sunscreen. You know, if all else fails, minimum is sunscreen. You know, some of the guys, like you said, they have clients who may not want to do anything. They're very lazy. Even if you tell them it's just 1 minute of your day. You know, so
Dr. Naveen, sorry to interrupt again, but your voice is again soft. Maybe you need to just come a little closer to your device, because I'm constantly getting messages that you're not audible.
Sure. Can you hear me now? Is that better?
Perfect.
Yeah, so I'll speak at this volume. So I'm just saying that when it comes to for male patients, they are, you know, people who would want to see a little bit more immediate results, and you know, don't want to have much downtime, and this would be a type of treatment that would work well.
Okay, so there's one question about the usage of skin boosters along with the carbon dioxide laser in the acne scars. See, currently I don't have any experience with this, but conceptually, I won't prefer a laser along with the skin boosters. because many a times with the laser heat, the skin boosters goes
No.
away earlier. So either do a CO2 laser, any sort of laser first, give a gap, and then go with the skin boosters. So what I usually practice is skin boosters are the last resort thing. After skin boosters, I don't want to touch my patient for next 3 to 4 months because you already hydrated the skin. You have to give time to the skin for elasticity to build up new collagen, new proteins for a healthier skin. So I don't touch the skin for next 3 months. Then obviously, when the skin get ample time, the results comes up.
So once again, we're getting into something in terms of timeline, folks. You know, you guys are asking questions in terms of combining these treatments. Now, the best thing to say is if you have time with this patient, these type of lasers, peel, whatever you wanted to do, would be done in like monthly intervals till you get to a point where now they're done. This is the max you'll be able to benefit with these type of technologies. Now let's add in on the skin booster like the cherry on top, like we were saying. You wouldn't want to combine these like Dr. Manu said. It will melt the filler, it will melt the product, it won't stay as long. And yeah, then I would definitely advise don't use the laser, only use the skin booster if that is the timeline you have, and just proceed with that treatment. Don't touch it. Absolutely.
Yeah, and the other thing, the logic behind this is lasers are giving heat to the body. So
yeah,
they're removing the hydration and the skin booster are for hydration. So I don't prefer two contradictory things at the same time. So probably that's a nice suggestion. I'll just see if I could use in my future clients. I think we can take a couple of more questions. There's a question on the mesobotox and the Vital. See, I usually, that's not the usual practice of combining mesobotox and the Vital. But in some cases where the results are expected to become within a week and stay longer, or a bit of firmness is required, I do mesobotox and Vital in the same session. First Vital, followed by a Botox. That's a any botulinum toxin in the mesoforms. So you have to be careful with the dilutions.
I'm
So
sorry.
Shreya,
Yeah, can you say it again? I lost you for a second. Can you just repeat what you were
so
just
we
saying?
just do mesotoxins along with Vital. I always prefer doing a Vital session first, followed by a mesotoxin section.
Yes. And do
So
you
that
extend
gives
it to the full face, or do you usually just keep it to the decollete
no,
area?
I do the meso session on the entire face. So
Full face. Okay.
yeah, so especially you get a bit of tightening, especially if a patient complains of open pores, that's an add-on. So you
Yeah.
get a glow, shine, as well as the tightening. So that makes the patient happy.
Yeah.
And with
For
doing
sure.
a mesotoxin along with the skin booster doesn't increase the budget of the patient too much.
Yeah.
So they get easily convinced for that. So just Shriyal, do we have more time to take some more questions?
Yes, Dr. Manu, you'll have 10 minutes more, so we can take questions. And on that note, I would repeat and request all the attendees to share your questions only in the Q&A box. I can see questions in the chat box and chances are they would get missed. The doctors are only referring to the Q&A box, please.
Okay.
Yes, Dr. Manu, over to you.
So this one asks about how many days after Vital you can apply your makeup and prevent the chance of infection. See, usually I ask my clients to avoid makeup for 24 hours. I put an antibiotic cream post procedure, ask them to do the same the next day. So what's your take on that, Dr. Naveen? So I haven't seen any sort of infections in that aspects.
Yeah, you know, to be honest, if they're coming and doing a procedure like this, they themselves are aware that, you know, you've done something invasive. There is going to be some sort of trauma that was inflicted. So we advise a topical antibiotic at least two times, twice a day, you're done. And with a good amount of sunscreen cover up. On top of the sunscreen, whatever you'd like to apply, that's your prerogative. But at least for 48 hours, let's try minimizing it. And they're aware of that. You know, you're not going to have that type of patient who really wants to immediately that night put on makeup. You know, they won't come the night of a procedure, you know, of an event to do this type of procedure. So it's very rare that question, but if it is something that really has to be done, I would suggest definitely a layer of a topical antibiotic, maybe a sunscreen on top of that. Maybe then on top of that, you can put a compact powder and your makeup on top.
Yeah, totally agree with that. See, many a times, I think there is one query regarding the how many sessions in the pigmentation of the melasma cases. See,
yeah.
Usually the advantage with the Restylane boosters is they are formed from the NASA technology. So it's a patented technology. And there's some recent papers which says that since hyaluronic acid formed from NASA technology, it stays longer. It lasts several, even few cases are there where it has lasted even for more than a year. So
Mhm.
what the basis of this is, whenever you're putting a skin booster, after 3 months or 6 months, when you're doing a second session of it, you are just putting an extra layer of a Nasha technology over the previous layer. So you get on increasing the layer of the Nasha technology with the skin booster. That's why the outcome is, over the time the pigmentation is going down, either with the whatever procedures or the treatment you are giving. At the same time, the hydration level of the skin and the skin quality is improving.
Yeah.
So the outcome would be a brighter, a plumpy, brighter, glowy, shiny skin with less pigmentation, and more hydration the skin will have, the lesser pigmented it will appear.
Yeah. A lot more elasticity if someone would want to
Lot
get
more
it.
elasticity. So exactly, I don't. I mean, it's difficult to say how much number of sessions, but the case I show that usually takes about 4 Vital sessions at a gap of 3 months each.
Oh, wow. Okay. It wasn't just with one session that you got that
No,
result.
no, it takes time because I have seen it's almost after an year of it. It takes time plus investment for that. Plus, but believe me, those skin patients with so much of, especially those melasma cases, they are very eager because currently there is nothing that works
That well.
this much. Yeah, but it takes time. It takes time, and
And
at
it's
the
a lot
same
of
time,
effort on their part, you know, a lot
yeah,
of
on their part
protection
as
that
well,
they have to
obviously.
do at home, you know, it's not something that we just do and they go.
Yeah. See, the most common thing which I encountered is when I started my practice, when skin boosters were introduced to me, my first reaction was, who will buy this expensive stuffs? I don't have, I can't know how to counsel these clients, and this they will. And my expectations was ki there will be a very small niche segment for these clients. So I had to draw my practice towards that. So over the time, my experience is, don't think about the cost behind this factor. If you value the outcome which you're getting from the skin boosters as such, you have to change your mindset first. You have a mindset of the value that you are giving to your patients. Then automatically the convincing comes. Automatically the patient gets convinced. Is who need to get convinced with the price of the product and the outcome. Unless and until you are convinced, your patient cannot be convinced. So this is what I have learned. And believe me, in my practice now, skin boosters is one of the busiest practice of these days for now for me. I use skin boosters for more or less each and every indication, each and every client, whomsoever walks to my clinic.
So a lot
Just
of
your
questions
experience, Dr.
are,
Naveen, how you started off.
no, I was, yeah, I agree. I was just saying a lot of questions are coming in and like they want to know the comparison to other products. What is the, you know, does this show faster? Does that show faster? Is this less painful? Is that, you know, so in my experience, I just want to say something. I've used skin boosters in various lines from different companies. One
Dr.
of the things
Naveen,
that
we
I've
can't
noticed,
hear you again, actually.
really? Okay.
Yeah.
One of the things that I've noticed in these terms, in terms of different comparing this to any other product, is that this tends to show a little bit faster. You know, when you give the product immediately, obviously with the inflammation and the trauma, you will get a little bit of glow. The blood rushes to the area. But the actual true effects take about 2 to 3 weeks to kick in, just as any other product. But for that immediate effect, you know, someone wants to get this done and they have an event in like 48 hours to 72 hours or something. This would definitely be something that may show a little bit faster in terms of pain, the way to do the procedure, the duration of the effect. I would say that all products stack up pretty much the same, though this might be a little bit on the relatively on the I think price-wise, maybe a couple of thousand rupees cheaper than standard other products. So this is a good thing to start with. This is a good product that you can definitely incorporate into your practice. Beginners, you'd love it. You really appreciate how the use of this syringes, and this is something that you should, you know, start using for definitely certain of these indications we've discussed today.
Yeah, for sure. I think we can take the last question. These are all the precautions and the complications associated with this.
Yeah.
To start with the precautions, I'll say first and the foremost thing, always make it a habit of taking pre and post pictures of the patients. Human memory is very, very short. They forget what they how they look and what the glow on the face is. And while taking the pictures, be careful. You don't have any light which is focusing from top. Always should be from the side. Otherwise, the pictures won't be good. Always make sure the background of the pics is important. It has to be same before and after the pic. And believe me, most of the patients just seeing the pictures, they get convinced. And it also helps you in getting the more and more clients by referring to those pictures. And secondly, about the complications, till now with the skin boosters, I haven't been across any complication as such. There are chances of a bruise. I witnessed bruise even in the cheeks areas, forehead areas. But in worst to worst, usually settles down in 24 hours. In worst to worst scenario, I have seen a bruise settling in 24 to 48 hours with the skin boosters. Nothing apart from that, I have witnessed any other complications. Just your take, Dr. Navi.
Yeah, so this is again,
Dr. Naveen can't hear you. Dr. Naveen, we can't hear you. Dr. Manu, can you hear Dr. Naveen?
Yeah, Dr. Naveen, your voice is not audible.
Okay, I think he's jumped off the session and he's joining in again. What we can do, Dr. Manu, if you want to quickly, go through the Q&A box towards the end to just see if there's any one last
I'm just,
important question
yeah.
that, is probably missed out on and you want to cover that.
There's a
yeah,
question about under.
I just wanted to say that last note in on the side effects. I'm sorry, is that this is very safe. New practitioners who've already used product and want to try something new, you'll love it. It's very easy to use. It's very safe to use. It can be incorporated into anything, and your clients will love it too. The ease and compliance in which they take the product and the effects that it shows. So definitely, I agree with what Dr. Manu said. Minimal bruising could occur, practitioner errors, certain areas you inject, off-label areas, yes, can manage that, but you have to speak to the client. Again, pre and post pictures, definitely signed consent, informed consent is important as well to protect yourself. And this is the way that you would do this type of procedure,
Yeah, perfect. Yeah, perfect, Dr. Naveen. I'll just take, there are 2 or 3 questions. I'll just brush them
Yes, please.
quickly.
And what you can do, Dr. Manu, is just go through them quickly, like just give your
Yeah.
insights, since we can also, hear you clearly like right now.
Yeah,
We
sure.
could just
So
have
number of sessions, usually 2 ml in the first session, followed by 1 ml every 6 months. That's usually what the guidelines are. And that's what we usually practice.
Yeah.
About the combination with the under eye peels. So if I had to combine a peel, I don't do an under eye peel. I just do a full face peel, maybe a Sally peel or a yellow peel, and then combine it with the Vital. There's no point using an under eye peel and then doing the skin boosters. Question about the skin boosters versus Profilo. Profilo is painful as compared to skin boosters. Plus, the technology of the profile and the skin boosters are entirely different. With the skin boosters, you can expect the glow, improvement in the elasticity, overall health of the skin improves. In compared to the Profilo, you expect a better firmness. So Profilo, I would prefer a client if she is around 55 plus. Skin boosters, I will prefer between 20 to 50. That is the what I could say. Mesobotox, there's a normal mesobotox techniques we use with this along with the skin boosters. Normally, you just do all over the face. You just do just dilute the botox, normal botulinum toxin 1:5 dilution, and just do raised blebs all over the face. I think we have taken most of the things.
I saw one question in regards to like a bruising from a different product, and they wanted to know does that type of how to manage it, a bruise or something. But we've discussed that as well.
Yes, so I think does that bring us to the end of this session?
I think we have taken almost all the things. If anything is left, just let us know. We can.
Sure.
We'll
So I was just
reply
coming to that. So I have the list of all the questions, and there was a lot that was also covered in a way while you all were explaining, the case studies. So this webinar link is going to be available on the Aesthetic Medicine India YouTube channel as well. So if any of you have joined in between, you'll have missed, the challenging case studies or the interesting case studies that were discussed. We would help you with the link to, which would have most of your questions answered. Apart from that, if any question is left unanswered, we'll ensure that we reach out to you with that. Having said that, that brings us to the end of today's webinar on achieving radiant skin with the original skin boosters. The webinar was organized by Aesthetic Medicine India and powered by Galderma. I would like to thank Dr. Manu Agarwal and Dr. Naveen Atluru for being a part of this webinar and sharing such great insights with us. It was indeed a great pleasure hearing from each of you. Our partner Galderma, thank you for all the support. I would also like to thank the viewers for all your support and presence at the webinar today. I think all of you have been equal moderators for our doctors with the number of questions that you all were pouring into the Q&A box. My apologies if due to time constraints, we've not been able to answer all of it. But like I said, we will come to you off the live. As we come to the end of this evening, you're looking forward to positive, safe times ahead for all of us. Thank you once again. Have a lovely evening, and I'm going to see you soon with the next episode on the Let's Talk series. So thank you, everybody.
Thank you, guys. Thank you, everyone.
Thank you. Great evening.
Good night.
Bye.
Good night.
Good night.